You're watching Cetome TV. Knowledge is power.
Our oncologist said that this type of cancer is not inherited. How would you respond to that?
Well, so what are they saying?
So we have a patient that is 22 years old and they have a cancer. And, we suggest to them that they get inherited genetic testing. And their oncologist says, there's no point. We're not going to give you genetic inherited testing. It's usually covered in Canada. It can take like years and years to get it, and it's very limited panels. But the oncologist said, this type of cancer is not inherited. Now, remember, the way these questions are phrased is really the key here.
Right. So the key, hint, thanks for the hint, is when they're saying this type of cancer, you have to be very direct and clear with them about what diagnostics they've used to find out what type of cancer you have. Did they use everything that was on the list that Alex gave, or did they just use the standard pathology, blood test, CT scan to diagnose you?
Right.
Because if they've just done that, then they're still thinking of your type of cancer from the perspective of breast cancer, lung cancer, pancreatic cancer, brain cancer, not the molecular features for which all the new cancer treatments are being designed. So they couldn't possibly say that again. They couldn't say this type of cancer doesn't respond if they haven't done the testing to find out really what mutations are driving your cancer, what's actually causing your cancer.
I think, these responses are worded very well. But if a patient is to hack away and ask them to redefine what they're saying, they will get to the bottom much quicker. So in this particular case, the patient asked the doctor responded with this statement. Our oncologist said that this type of cancer is not inherited. Well, that is correct. A cancer is, only in very, very rare cases, is a cancer inherited. Cancers are not inherited. Genetic mutations in genes that create sensitivity and susceptibility to cancer are inherited. And that is why it's a trick answer. So you can have a BRCA1 mutation, and that is going to increase your risk of certain types of cancers. You may get a blood cancer, you may get a breast cancer, you may get ovarian cancer, you may get many different types of cancers as a consequence of that. If you have an ATM inherited mutation, if you have an NF mutation. So, a cancer is not inherited, but the mutations in the genes that cause the cancer are.
I see.
And so the oncologist is correct in responding that way, but they're completely avoiding the actual issue.
Okay.
So the patient in this case should have said, can you test me for genes that create a susceptibility to cancers?
Right. That's the question. Can you test me for genes that create a susceptibility to cancers?
Yes.
Right. Because that way I'm going to know, I'm going to find out if I have these mutations that create a susceptibility that
that are passed on.
Thank you for watching Cetome TV. Subscribe below and stay informed.